And I was looking in the wrong place. Greetings. This is the third time of trying to do this recording. I seem to make it 3 times every time. That's kind of my lucky number. Well, I am 2 weeks into this new lot of chemotherapy. I think I told you what the name was in the last recording. If I haven't, I'll tell you in the next one because I can't find it at the moment. This particular chemotherapy tablet is nasty. This is nastier than the last one. This one you can't touch with your hands, and you've got to take it with a mouthful of water so that it doesn't touch the sides of your mouth. It's because it'll irritate anything that it touches. So that's why you have to take an antacid tablet, but you also have to take an anti-sickness tablet half an hour before taking it. And it thins your hair, but you don't actually lose your hair. 2 weeks in, and I've experienced maybe 2 to 3 bouts of nausea, and even then that's not anywhere near as much as I had when I had chemotherapy 3 years ago with the breast cancer, because that chemotherapy was one big hit of FEC, and then docetaxel was the next lot, and you just felt really sick for the first week, then you were starting to recover the second week, and then you felt absolutely great the third week, just before starting the next lot of chemo, which set you right back again. So you kind of were able to work your life out in stages of 3 weeks last time. This particular chemotherapy, I see the doctor once a week. Yeah. I'm afraid I've got a bit of a... It's not a moan. It's an observation, I guess. I've got lung cancer, as well as liver cancer. I wasn't told this until the appointment before last. I've also been told that the tumour that they zapped with the radiotherapy 5 times has shrunk, but hasn't actually gone. I had to ask the consultant about how the tumour was doing. Had it been zapped or hadn't it? Had it gone? Was it still there? Had it been reduced or what? I had to actually ask that. I wasn't given that information. It makes me wonder how much else they're keeping from me. Now I feel extremely disappointed. I cannot begin to tell you how disappointed I am in my consultant at the moment. I'm probably being totally irrational and hormonal and everything else and whatever else my husband and eldest son and anyone else wants to consider that I am. But if they didn't tell me about the lung cancer, and they didn't tell me that the tumour that was in my spine hadn't actually gone, which was what I was led to believe would happen, like I said, what else are they keeping from me? Some patients are happy not to know things. You know, just get on with the treatment, do what you have to do, and I don't want to know what it does. I've known people like that, and that's absolutely fine. If that's the way they want it, that's the way they have it. They don't want to know anything about the details, just give me the tablets, do the treatment, and I don't want to know anything else. Some people would like to know everything there is to know, and would like the truth laid out absolutely, totally in front of me. I don't want anything hidden. I've been seeing a different consultant the past, I think, 3 times. I've been on a Tuesday, because this particular consultant goes in on a Tuesday. She used to be my actual consultant's registrar. And don't get me wrong, she's absolutely sweet. She's fine. But I don't feel she's telling me everything. And I don't think she's actually listening to what I'm saying. The one person I know is actually listening to me at the moment is the lady who comes from the Countess Mountbatten. She's a community nurse, senior, I think, one of the senior community nurses, who comes and visits me about once a fortnight or so, and we just sit and have a coffee and talk about various things that we touch upon. Some very personal things that we touch upon, of which I'll mention in the next podcast. But she's the only one who seems to be in the medical profession listening to me. Sometimes you can see in a consultant's eyes, or see in hear in their expression, that you can almost tell that they've already got their answer to what you're saying before you've actually asked a question. And you can hear the cogs turning. And what I get from this particular consultant is a lot of huffing and puffing. Well, I think we'll treat this tumour with painkillers, and we'll see if this tumour will reduce with these particular chemotherapy. I don't think necessarily that, radiotherapy will help it very much. She didn't explain why. The Countess Mountbatten lady, she explained why. And she also told me that I do have a right to ask for my particular consultant to see me that day. That it's not a case necessarily of me being passed over to this consultant. It's simply that she might have seen me 3 times, and Dr. Simmons has got 5 patients to see. She's got 3 patients to see, so she will take me off Dr. Simmons's list. I don't know. And that's precisely my problem. I don't know. And I should know. A patient has the right to clarification and knowledge of what's going on. If there's any junior doctors out there, please understand your patient as to whether or not they want to know things, whether or not they're happy to not to know and to just get on with the treatment and keep everything else to yourself, or whether or not they're like myself, who wants truth, basically, and clarity and consistency. And I am absolutely devastated to say, for the first time, the very first time in 3 years of knowing this particular consultant, that's not what I'm getting. I'm feeling fobbed off. And I'm fed up. Next podcast.